All right, so for my few tests, first off, we'll start with ankle dorsiflexion MMT, which also involves inversion as well. For this test, we're testing the tibialis anterior. So if you can dorsiflex and invert a little bit, that muscle will be about right here on the leg and of course on both sides. So for this test, we'll go through the range of motion, make sure there's no pain. Any pain?
No pain.
Perfect. All right. So we'll have the patient stay right here, stay in that dorsiflex and inverted position. I will be placing a stabilizing hand right behind the leg, kind of behind the ankle a little bit, and the force will be applied downward and into eversion. So into plantar flexion and eversion. So are you ready for that resistance? Just hold against it.
All right.
And boom. Perfect. So that would be a 5. A 4 would be he would hold, but against like minimal resistance. A 3 would be he would just be able to get through the range of motion and not hold against any resistance at all. And of course, we'll test both sides. So we'll do the same thing over here. Can you go dorsiflexion and eversion? Any pain with that?
Nope.
All right. So let's keep in that position. You ready?
Ready.
All right. Hold, hold, hold. Perfect. So that would also be a 5 as well. All right, so now for the gravity minimized positions, we're gonna have them lay in supine on a table. For this, we want to see if they can still go through the range of motion. If they can go through the full range of motion, it will be a 2. So here's that. So we'll have the patient dorsiflex and evert like that. All right, any pain with that still? Invert, my bad.
No pain with that.
No pain with that, perfect. So can you do that by yourself? Go up and invert, perfect. And you palpate that tibialis anterior to make sure there is a contraction there. A 1 would be you can't go through the full range of motion, but you can still feel the activation of the tibialis anterior. And a 0 would be no activation of that muscle at all. So just to keep consistent, we'll also do it on this leg. So can you go through that motion? Dorsiflex and invert. Make sure to palpate right here. All right, you can relax. That would be a 2 as well. So for the tibialis anterior, we're testing the deep fibular nerve or peroneal nerve, which is also which are the spinal nerve roots of L5 and S1. So for my next test, we're going to test the great toe extension. For this, you're going to move the toe passively, test for infield. We're going to have a firm infield due to the plantar capsule down here. So to start measuring, you'll have your axis of rotation at the first metatarsal pharyngeal joint right here. You'll find the midline of the first metatarsal. You'll line up your proximal arm with that. The distal arm will be lined up with the midline of the first phalange, first proximal phalange. And you'll have the patient extend the toe as far as possible. There we go. And then measure that. You'll get, oh, yep, still going, perfect. And that is going to be 66 degrees. So for this, you want to make sure that they aren't in any dorsiflexion either. This could greatly limit the measurement of toe extension. If you could extend your toe for me. That's as far as he can go right there. And it is less. For him, it's not much less. It's only 55. But still, you will get a false. All right, so now we're going to be testing the other side to make sure that the reading we got on the first foot is similar to the reading on the second foot. So we'll use the same proximal and distal arm, same axis of rotation, just on the other side. You'll make sure they're not in dorsiflexion, they're just relaxed. So you'll line that up. Can you extend your toe for me? Perfect. And this one is 72 degrees. So it's a little bit more, but about around the same. The normal range value for this is 70 degrees.